just after noon. So welcome everybody again to the next session of the Sheep Vet Society Virtual Conference. Without further ado, I'm going to hand over to Amanda Carson, who is going to chair this session, which we're really looking forward to. Amanda, over to you.
Thank you, Philippa, and welcome everybody to this second session of the Sheep Veterinary Society virtual conference. We had a great presentation earlier this morning, and I'm now delighted to introduce Felix Njuemie. Felix is a veterinary surgeon from Cameroon and holds a PhD in epidemiology and zoonosis control, and is currently associate professor at the University of Bologna. From 2007 to 2011, Felix was the secretary of the Global Rinderpest Eradication Programme and has received numerous awards and commendations from around the world. Currently, Felix is associate professor at Bologna University and is the FAO coordinator of the joint FAO and OIE Global Eradication Programme for PPR, that's Peste, the Petits Ruminants. His work has taken him to over 140 different countries around the world, where he has advised and assisted governments and international institutions on the control of transboundary diseases, public health, improvements in livestock production, and agricultural development. Felix is fluent in a number of languages, but he'll be speaking to us today in English, and this morning he's going to talk about the Global Eradication Plan for PPR. It's truly astonishing work, and I think you will be amazed by the talk that Felix is about to begin. But we're going to begin with a video that sets the scene.
Petits Ruminant, PPR for short, is a menacing disease for pastoralists. It's often referred to as a goat plague because it's a highly contagious virus infecting small ruminants like sheep and goats.
Well, I think that tells us how important PPR is to people in developing countries and the impact it can have on the livestock that they depend upon. So I'd like to hand over now to Felix to give his presentation on the Global Eradication Programme. Thank you, Felix.
Thank you, Amanda, and good morning, all of you. It is a pleasure for me to address you and explain and maybe share with you what we have been doing at the global, regional, and country level in terms of the Peste des Petits Ruminants Global Eradication Program. As Amanda just mentioned, I am coordinating this program, amazing program where we need the assistance of all veterinarians around the world to work together toward the eradication of this disease in 2030. My presentation will focus in four major areas. What is PPR? What is the role of the small ruminant production in our livelihood? What is this strategy on Peste des Petits Ruminants and even the program? What we have been doing since the program was, or the strategy was launched in 2015. What is the status of the resource mobilization? But without starting, maybe I have to share with you that in our history, 2 diseases has been eradicated. One in human, smallpox in 1980, and during the pest eradication in May and June 2011. With this one, we veterinarian and physician, we are at the same level. They managed to eradicate one disease, and we veterinarian, we also eradicate the second one. Now there's competition. Which institution will eradicate the second disease? But in any case, when the rinderpest was eradicated in 2011, member country, the 193 member country of FAO, they recognized what was done, but then they encouraged FAO to take advantages of the rinderpest achievement and apply the lesson learned to prevent and control all the disease impacting food security, public health, the sustainability of agricultural system, and rural development. We tried doing the global survey to understand what could be the disease with all the parameters that we can target for the eradication. They were FMD, foot and mouth disease, Peste des Petits Ruminants, Newcastle disease, avian influenza, but we thought that PPR was the only disease where we have the good vaccine. Because one of the major parameters to eradicate the disease is that you should have a good vaccine. But the good vaccine, it means long life, one single injection, but long life immunity. But when we are talking about small ruminant, other reason why we were targeting Peste des Petits Ruminants was the role that the livestock play in agriculture. And it contributes almost 40% of the GDP. But we have also taken into account that 70% of the 1 billion people around the world living with less than $2 per day rely on livestock for their survival. But livestock also provide protein, micronutrient, but it is also insurance in case of crop failure. Because we know in pastoral area, in developing country, we have those who are growing crops, but they also have animals. When there's crop failure, they rely on livestock. But most importantly, small ruminant in developing country is the property of women, therefore gender issue. If you go in any village around in developing countries, the first thing that if you go to mom and lady, their livelihood is small ruminant, because from small ruminant, they can maybe draw milk for growing their children, or even they can sell. It could also have social role. We know the role of small ruminant in Islamic culture. Dowry in several countries, developing countries in Africa and Asia. But when we are talking again about Peste des Petits Ruminants, we have to compare it with rinderpest. Rinderpest, we were calling it the 3Ds disease. What are the 3D? The first D is for diarrhea. The disease, the animal cattle has diarrhea. The second one, the second D is discharge. It could be nasal discharge, it could be ocular discharge, and so on. The third one is death. The mortality for rinderpest was above 90% when it reached susceptible animal. The same thing for Peste des Petits Ruminants. We have again the 3Ds, but in addition to that, we have bronchopneumonia. These are the major signs that any veterinarian you should be looking for if you are looking for Peste des Petits Ruminants. Peste des Petits Ruminants was diagnosed for the first time in Côte d'Ivoire in year 1940. And from there, slowly, start spreading. till 72, it was only the disease of West Africa. Nobody was thinking that it will have this global impact. Then between 80 and 82, the disease occurred in Sudan. Why this country in the middle, Chad and Central Africa Republic? Because they didn't diagnose the disease. The disease was circulating there. Then in 1987, the disease was discovered in India. What about all this country of Middle East? This is where epidemiology, they start working. And then in 2008, 20 years later, with the ELISA kit, we discovered that the disease was spread from Senegal till China. But one of the major reasons why we have also to target PPR for eradication is that we have to try to see whether there's any correlation between poverty, small ruminant density, and the prevalence of PPR. If you take only Africa, Middle East, and Asia, you will see that the poverty line, those living with less than $2 per day, they are more or less in intra-African country, intertropical African country, Middle East and Asia, China, Mongolia, Kazakhstan. When you see again the small ruminant is more or less the same distribution. When you look the PPR distribution is more or less the same. Therefore, there is strong correlation between poverty, small ruminant density, and PPR eradication. One of the conclusions is that if we are looking for sustainable development goal, if we want to achieve the sustainable development goal, we want to eradicate poverty around the world, Peste des Petits Ruminants could be one of the diseases that eradicating Peste des Petits Ruminants, we are also addressing the gender issue. Because ladies in developing countries, they will be able to have their sheep and goat, they will be able to sell it and have money for any other, sending their kid at school, bringing them to the physician, and use that money for any expenditure that they have, because this is their property in developing countries. Therefore, one of the lessons that I think that we should take back is that the strong correlation between poverty, small ruminant density, and PPR. Therefore, eradicating PPR is also eradicating hunger. But PPR is also infected other species, not only sheep and goat. In 2018, for the first time, the disease was discovered in Saiga population in Mongolia. And we know that Saiga is endangered species. In less than 1 month, more than 80% of the Saiga population died due to PPR. Therefore, there's also a problem of biodiversity in terms of people as far as PPR is concerned. We also have case of PPR in camel, in buffalo, and even in cattle and in pig. Therefore, almost all species, they are involved in terms of PPR. But when we are talking now, the second reason why we were looking for PPR is that member country, minister, they need number. Convince us in terms of number that your strategy is acceptable. Therefore, we start looking about the socio-economic impact on PPR. We realize that every year, the PPR causes 1.2 to 2.1 billion losses in terms of socio-economic impact, of which 40% of this 2.1 billion is in Africa, 27% in South Asia, 20% in East Asia, 7% in Middle East, and 6% in West Asia. In terms of the strategy, as I was saying, the strategy was launched in 2015 with 3 major objectives. The first one is to eradicate PPR by 2030. The second one, we have to strengthen vet services. The third one, we have to incentivize those having small ruminants. If we are controlling PPR, why we can also control and reduce the incidence of other infectious disease of small ruminants. But PPR eradication, as I was saying, is contributing on fighting rural poverty, ensuring food security and nutrition. If we have meat, what is the request in terms of meat by 2030? We are thinking that by 2030, with the normal population globally, we may need tenfold increasing of the small ruminant production. In terms of nutrition, what is the need in terms of milk? You saw in the video how only the PPR eradication, PPR outbreak is able to impact the livelihood of families. It is also it strengthens resilience and national economy. The SDG, the Sustainable Development Goal, the 17 SDGs are bringing us for leaving no one behind, eradicating poverty by 2030. Therefore, the second lesson that I think that you should take home is that we veterinarians, we who are involved in the sheep or goat production, if we are able to eradicate PPR by 2030, we will be able to say, yes, we also make our contribution for contributing to the SDGs. And this is a challenge for us. Let us work together for that one. Then, when the strategy I was saying was launched in 2015, we start thinking, strategy is what I am calling blah, 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 blah. We talk, but let us go in action. Less blah, blah, more do. What are we able to achieve? We turn the strategy in program, on action. How are we able to implement this strategy? And in 2018, we gathered in Brussels with the commissioner, the DG, the Director General of OIE and FAO, then with Minister of several countries, thinking about how are we able to have more resources to eradicate the disease. But the strategy has 4 stages. At the first stages, we have to make sure that we do the assessment. Where are the country placed? Are they in stage 1? This should be through epidemiology. We have to do the surveillance, map the distribution of the disease at the country level. When we know where the disease is, we will move to stage 2, where we control the disease in few areas. And then stage 3, we have to make sure that all the territory of the country, the vaccine, we have used the vaccine, we have immunized, reduced the incidence of the disease at the low level. When we are sure that the immunity is very high, above 75%, we are able now to declare stopping the vaccination and move to post-eradication, doing the surveillance to make sure that there's no virus circulation, and then moving the strategy, moving to writing the dossier for OIE for accreditation. Therefore, this stage corresponds to the combination of decreasing level of epidemiological risk to make sure that country move from one stage to another. But country can move directly even from stage 1 to stage 4, or from stage 1 to 2, 2 to 3, and so on. But what we have to take into account is that the third lesson learned, in terms of strategy, country could move from one, when he knows the country, we know the epidemiological situation of the country. If there is no disease circulation, country can move directly in stage 4 and apply for freedom. But we need the technical element. What are these 5 technical elements that we have to take into account? The first one, as we are talking about vet services, what is the legal framework in terms of PPR at the country level? What is the surveillance system at the country? Do we have the surveillance system able to detect any case of PPR at any time? Do we have the diagnostic capacity at the country level, able to diagnose the disease as quick as possible? And I have to take the opportunity to thank UK, because UK was the leader with Pearl-Bright, who were able to prepare the Penside test, the ELISA test. The Penside test is this test that we are able to use at the field level. And in few minutes, we are able to have at least to have indication of the situation of the disease. Then the 4th technical element is the prevention. How are we able to use the vaccine to immunize animals? The last one, the 5th one, is the stakeholder. We have to involve all stakeholders in vaccination, in surveillance, in legal framework, in laboratory, and so on. Therefore, you who are connected now, you are also stakeholder. We need your assistance to make sure that this happens. The strategy to move from one stage to another, we have the tool that we are using. This is the PMAT, the PPR Monitoring and Assessment Tool, that aim to monitor PPR Global Control and Eradication Strategy implementation and assess progress where country is. Using the PMAT, we are able to categorize country, whether it is in level 1, 2, 3, or 4. We have it also assists to provide guidelines for infected countries. But over the last 5 years, we discovered that there were problems with this PMAT. Now in 2020, we are reviewing the PMAT. Recently in June, we sent almost 150 questionnaires around the world to ask the view of countries. What were the challenges that they face in implementing the PMAT? We had almost 80% reply from country. Now we are analyzing it to remodify, reshuffle the PMAT so that it is adopted based on the need of the countries. But for PPR, we also divide all infected countries in region, where we have West Africa region, North Africa, Central Africa, South Africa, Eastern Africa, Middle East, Central Asia, South Asia, and Southeast Asia. And we have been gathering all these countries to have their view and assess progress with what we are calling the roadmap meeting, bringing all of them to ensure continuity in assessment and monitoring of all disease situations. During the roadmap meeting, they have to do their self-assessment based on their epidemiological situation. Where are you? Are you stage 1, 2, 3, or 4? But the self-assessment have to be, because they have as other neighboring countries they are there. If you say that you are in stage 1, you have to convince your neighboring country that you are in that stages. Because you are able to tell them, oh, I am in stage 4. They will tell you, no, my dear, last year you were still doing the vaccination. Therefore, you are not in stage 4. Review again, you are. Then during that roadmap, we have also to identify challenges that they are facing for the implementation of the global eradication program. Then we promote regional approach, and we also try to involve partners for the eradication. In terms of the program,
Felix,
yes, Amanda.
Can I just ask that, you know, when you're looking at some of these countries, do they have the veterinary services that can carry out the surveillance to determine the stage that it is at? I'm thinking about, you know, some countries, for example,
Somalia.
Mongolia and yes. You know, are the veterinary services available, or are they provided by other international groups who go in to assist?
Okay, I can take maybe the case of Mongolia and Somalia. Mongolia, for example, I will come back on it later. When they were the first outbreak, myself and Richard Koch from Royal Vet College in the wildlife group, we had a mission in Mongolia to assist to understand the situation and advise them accordingly. Then we try to involve the Wildlife Conservation Society to make sure that the component of wildlife, of biodiversity, is involved. Therefore, the Minister of Agriculture of Mongolia will not be working alone, but they have to bring into take into account the Ministry of Environment for the wildlife component. Therefore, FAO, OIE, Wildlife Conservation Society, we were working all together to assist Mongolia to address the disease. They have been doing the vaccination and surveillance. Therefore, the surveillance is there. But if we take the case of Somalia, where there is no government, we are using NGOs to undertake the surveillance and then carry out the vaccination. Therefore, during the roadmap meeting, country, they have to bring data in terms of vaccination or in terms of surveillance. Have they undertaken the surveillance? What is the prevalence? What is the situation, the map, the distribution of the disease at the country? Based on this information, we assess whether they are in stage 1, 2, or 3, or 4. I hope that I address your... Okay, then the global strategy, as I was saying, the strategy, we turn the strategy on program. If you remember, the strategy have 3 components. But when we start thinking about the program, we divide the first objective, eradicating PPR by 2030, we divide them in two objectives. For country infected, one objective, and for country non-infected, another group. Because for country non-infected, they have also only to do the surveillance and prove that they have never got any disease. But for country infected, they have to follow all the stages, doing the surveillance to map the disease, doing the vaccination, stop the vaccination, and then prove that the disease is not circulating, finally apply for freedom. But we still have stage 4 and stage 5, again, vet services and reducing the incidence of other small ruminant diseases. Yes, Amanda.
So it's interesting when you say that countries who may suppose that they are free of the disease still have to demonstrate that. So I'm just thinking for a country, for example, the United Kingdom, we may be required by the OIE to undertake a surveillance program to demonstrate. It may not be sufficient to say we've never seen it because you've never looked. So is that something that you know everybody would have to do, and to undertake some sort of surveillance program to definitively say they don't have the disease?
Yes and no. No, because there are country in America, the probability for them to have the disease is really very, very low. Therefore, sometimes we don't ask them for surveillance data, or many countries of Europe, because they don't have any contact with infected countries. They have only to write a letter that we have never get any case of PPR in our country. We have the good surveillance system in place. The legal framework is there. We have never used the vaccine at the country level. Therefore, consider us and place us as a freedom country. And UK did it. But for country neighboring Turkey, being in Europe, they have Armenia, for example, they have to prove that they have not get any incursion of the disease in the country because they are close to infected countries.
And
Australia,
so, for example,
yes.
Bulgaria had an outbreak a couple of years ago.
In 2018.
Yes, and they've worked hard to eradicate it. So they are currently undertaking surveillance to demonstrate freedom of it.
Yes. And the disease, it seemed that the disease was coming from Turkey.
Yes.
It seems, I am not 100, don't quote me anywhere. But in any case, the program, we try to divide the program in 4 components. The first component is that we are promoting and we try to enable environment so that we reinforce vet services. And it came on what you were saying, Amanda. We have to make sure that we engage all stakeholders. We prepare the national strategic plan that will come on it later. We have to make sure that the legal framework is in place. They have the strong vet services. In component 2 is laboratory and surveillance. Component 3 is more or less vaccination. We were looking for 2017-2021 for the first phase of the program. We were targeting to vaccinate 1.5 billion sheep and goats. Therefore, we will come on it. Do we have the capacity to produce 1.5 billion doses of vaccine? Then the 4th component is the coordination and management. But when we start looking the vaccine itself, why we are targeting PPR? Because, as I was saying, the vaccine is effective, giving long life immunity, 3 years. It is cheap, 6 cents, compared to the cost of 1 goat. It means that you invest 6 cents, you save the life of your animal. With only single injection. We have the laboratory who are ensuring the quality control of this vaccine. There has been a lot of research in terms of combining vaccine, PPR, and maybe sheep and goat. But you know that we are talking PPR or small ruminant, as we see previously, it is in pastoral areas where the temperature sometimes is above 30, above 40. But the vaccine, we need the thermotolerant vaccine. Now the vaccine that we have is not thermotolerant. Another big problem that we will be facing is the diva. Because when we use the ELISA kit and we detect that the animal is positive, we are not able to say whether the positivity is due to the field infection or to the vaccination. Therefore, we need the diva. As I was saying, this roadmap meeting, we have been organizing roadmap meeting in all these 9 regions. We are visiting each region at least twice to assess the process. But when we assess the process, we ask country, they have to do their self-assessment. If I take, for example, the case of Afghanistan, the roadmap for SAARC countries, Afghanistan for them, based on their epidemiologic situation, in 2016, they were in stage 1. They will have been in stage 2 till 2018, and then stay in stage 3 till 2024, and be free by 2026. And if you look carefully, almost all the countries in that region, they are planning that by 2028, they will be free. Therefore, the process is there. But let us now look maybe all these countries. As I was saying, if you look maybe countries, in 2017, in red are countries who were, after the assessment, they were at stage 1. Look how they decrease in stage 1. In stage 1, the number of countries, they decrease a lot. It means that slowly, so even in Middle East, we don't have country in Middle East except Yemen, who is still in stage 1. If not all countries in Middle East, they move to level 3. Then even if you look level 3 and 4, many countries in 2017, only country, Botswana was now even in stage 4, there are countries who are already in stage 4. It means that slowly, we're improving. But coming back on what you were saying, Amanda, UK is already free. You are lucky.
Good.
You are lucky.
Felix, can I ask another question?
Yes.
Where is the vaccine made?
I am coming on it now.
Oh, okay.
Therefore, globally, if we want to achieve 2030, we need to accredit 198 countries and territories. As per 2020, 58 countries are already, 58 countries and 1 in the zonal base in Namibia are already free. We have 61 countries, at least, those countries bordering infected countries. We have 79 countries who have been attending roadmap meeting, who may be infected or not. Of these, 30 countries are in stage 1, 38 are in stage 2, 5 in stage 3, and 6 in stage 4. Therefore, for the program, we still have a long way to go, but I think that we are able to achieve. The strategy
you've also achieved freedom in 6 countries. I mean, that's amazing, isn't it? There are 6 countries.
Yes, in 58 countries already. It means that around 1/3 of the country are already free. Sorry?
But in your 79 countries that are engaged in the regional roadmap, there are 6 countries who've moved to stage 4.
Yes, stage 4 is not that they have now to apply for freedom.
Ah, yes, but I mean
they have to apply for freedom. They have to write a dossier, a full dossier, to convince the international community that yes, we did everything, and please accept that we are free. They have to prove that they are in stage 4. In stage 4, then they will get the freedom status. But as I was saying, less blah blah, more do. Instead of sitting at the global level, we try to make sure that the strategy is labeled at the regional level and also at the country level. Therefore, all regions, they have their regional strategy. 8 over 9 regions. 68 countries over 79 have their national strategic plan. It means that if today this one student from Royal Vet College from Liverpool, who want maybe to undertake any study in Mongolia, we are able to tell him, okay, look, this is the national strategic plan of Mongolia. Please look first, what is their strategy? What are the activities that they want to implement by 2022? And then maybe you can model your research based on that national strategic or even the regional strategy. But the national strategic plan was developed and validated by a stakeholder and even endorsed by the Ministry of Agriculture. But we have to mainstream this national strategy in the existing agricultural sector program. Because one of the major problems that we veterinarians we have, and I have one friend of mine, he was at the World Bank. He always told me, you veterinarian, you are one of the stupid professions that we never know, I ever see. I was nervous at the beginning, then I asked him why. He told me, look, when we are looking in terms of ring-tail pest eradication, you have never done a lot of awareness on your achievement eradicating one disease from the planet. This is the major achievement, but we have never made sure that we advocate for it. The veterinarian, we have been trained as physicians, injecting maybe only clinicians. We don't have veterinarians who are strategic thinkers, who are able to prepare policy paper and try to involve, to convince international community. At FAO, for example, we have never got the highest person that we have get as veterinarian as being the Deputy Director General. Why we cannot be Director General of FAO? Why we cannot be Secretary General of the UN? Why? Because veterinarian, we have to change we have the mindset, we have to change our mind. This is where I am calling maybe those in the training of veterinarian. We have to start thinking about training veterinarian to make business. But to this national strategic plan, we have to make sure that we also have the assessment plan. The assessment plan is the epidemiological situation, understanding the epidemiological situation that can assist you to move to stage 2, where in stage 2, you start doing the vaccination, and then even stage 3. The same, but we have now the repository of this national strategic plan and regional strategy. Coming back on what you, Amanda, you were asking, yes, we have the governance, the advisory committee. I forget that in July, recently, last July, we had the 4th Visual Advisory Committee. The advisory committee, there are 15. There are those that should come once per year. We present our work plan, what we have been doing during the last 1 year, and they tell us, guy, you are making a mistake. This is not the right direction. You divert, you have to do 1, 2, 3, 4, 5. This is the role of the advisory committee. Then we have the PPR Global Research and Expertise Network, where all of you connected now, you should be part of it. All those doing the research on PPR, the small ruminant production, those who are caring about small ruminant, they are also part of this network. The next meeting will be held in November this year. We want to invite all of you to attend and understand what we have been doing so that you could be also part of that. Coming back on the vaccine, where are they producing the vaccine? Since 2014, we have been gathering the 32 vaccine producers around the table every 2 years to identify what are the challenges that they are facing in terms of quality and quantity of the vaccine that they are producing. And this is the reason why I just mentioned the unit cost of the vaccine now is 6 cents. In 2015, it was 10 to 15 cents. Because they increased the production, the price, they start reducing. We have the quality control, AU PANVAC in Africa, who is ensuring the quality control. During each meeting, we try to make sure that we make recommendations. What are the major challenges? How are we able to address them? Therefore, Amanda, there are around 30 vaccine producers around the world. Most of them, 15 of them are in Africa, other they are in Middle East and in Asia. Then we also have the biodiversity component. When the disease occurs in Mongolia, the biodiversity, they start worrying. Maybe the disease will destroy all the wildlife species around the world. Therefore, we gather with the support, as I was saying, Royal Vet College and Wildlife Conservation Society. We gather all of them in Rome. And the next meeting, I hope, will be in London next year in Royal Vet College. Again, maybe all of you will be invited. It could be maybe in Royal Vet College or in Nairobi, but we have to decide according to the situation of COVID. However, you see all institutions involved on the wildlife, they were invited and they give their view. But we start thinking, okay, we try to organize the 9 regions based on the regional economic community. It's political regional economic community, but the disease is not following. We are talking about pastoral area. The disease are at the ecosystem level. They are at the epizone level. Therefore, we start thinking that there's need for us to group country based on the epizone. We had last year the first meeting in Cameroon. I don't know whether Brownie Jones or Richard Koch, we were together in Yaoundé last year to discuss updating the implementation of the program based on the epizone. We were also supposed to identify epidemiological concerns, identify what are the major epizones that we should be targeting our control measure on in all epizones. But we did the SWOT analysis to understand what is the difference between comparing mass vaccination to target vaccination. But we cannot do anything without resources. As I was saying, the first phase of the program, we were targeting what we are calling the small billion. $996 million we were looking between 2017 and 2021. By 2018, we managed to get almost 656 million from donors, but we still have the gap. Since Brussels in 2018, we managed to raise around 65 million. But what we have to understand is that for 5 years, we are looking for $998 million. But if you remember the socioeconomic impact per year is around 2.1 billion. It means that if you are able to invest 1 billion, less than 1 billion in 5 years, we will reduce the losses of 2.1 billion. This is, again, maybe one of the lessons that I think that you should take home. But in general, there are 4 or 5 messages that I think that you should make sure that you take it after my blah, blah, blah of this morning. The first one is that there's the international consensus, and we think that although connected now, they will also be part of this consensus. There's the good vaccine to eradicate the disease. OIE and FAO are engaged. All stakeholders, being veterinary services, regional economic community, are all traders and so on. They are all involved. But we are facing few problems in terms of coordination. Because in terms of vaccination, many countries, they are doing what we are calling political vaccination. When they are close to the election, the president or the minister, they will buy a few doses of vaccine. As their pastoralists, they will say, oh, we bring the vaccine, they do the vaccination, and then they disappear. This is what we are calling the political vaccination. We have to increase the number of the vaccine. Now the immunity rate is around 20-25%. We are targeting 75% immunity if we want to eradicate the disease. This is the funding gap, and I call of you to be the ambassador for the PPI eradication. Because if we are able, all of us, to join forces in this PPI Green Global Research and Expertise Network, we'll be able to advocate, each of you advocating within the minister, NGOs, even ourselves, we can also support the program. Maybe we can take a resolution today that everybody by 2021 will assist vaccinating 5 goats, assisting a mom in Kenya, maybe in Mali, to vaccinate 10 animals. If we are able to do it, we'll be able in 2030 to say around the world, to gather somewhere around the world. It could be in UK, it could be in Rome, it could be anywhere around the world, and say to the international community, yes, we make it. We eradicate the second disease. We achieve, as veterinarian, as the sheep community, we eradicate one of the major diseases of this ruminant. Thank you.
Felix, thank you. I'm quite stunned, and there's been quite a lot of comments coming through on the chat line about how inspiring this talk has been, and how everybody's, you know, feeling fired up to recognize, you know, what's going on, and I think a lot of people are now wondering what they can do and how they can contribute. And I think that's something that, you know, the Sheep Veterinary Society will take away and think about very, very seriously. There's a lot of questions coming through, and I wonder if I could start off by just asking a couple. These are from me, really. You talked about the ELISA test. Now, I understand that's a pen-side test. Is that correct?
Yes, pen-side test.
So that means that it's very quick to diagnose animals with it, and it can be used out in the field?
Yes, and it was produced by Purbright.
Yes, that's quite amazing. The second thing was I wanted to ask was, what about vaccinating wildlife? Are there any proposals? I was thinking of, you know, the Saiga deer, although their population's been decimated now, but, you know, with a large population of deer, are there plans to vaccinate wildlife, or is controlling it in the small ruminant population sufficient?
What we know is that if you control the disease at the sources is small ruminant, you will also be controlling the disease in wildlife. And this example, we get it in Mongolia. We are applying it also in Kenya now. Where during the Green meeting in Nairobi last year, they requested that we should do the vaccination at the wildlife livestock interface. If we are able to immunize animals at the where small ruminant and wildlife interact, we are directly protecting the wildlife population. Because vaccinating wildlife will be really very, very, very difficult.
We've got a question here from one of our attendees, again about the vaccine, and they said, how realistic would it be to develop a thermotolerant vaccine? Because you did describe the vaccine you got is already a DIVA vaccine, is that right?
The vaccine that we have now is not, at least the vaccine that we have now, we need the cold chain facility. Yeah. But we already have the technology from Peste. Lesson learned from Peste. The technology is available to also prepare the thermotolerant vaccine. And it has been done. Now we are in the process of the validation. With the support again of the UK through GAFMED, we have been working with AU PanVac to validate the thermotolerant vaccine. And we hope that by mid next year, it will be validated so that countries, they have several types of vaccine. They can use those, maybe those without that need the cold chain or not. The technology is there, is already there.
And could you just clarify, is the vaccine at the moment a DIVA vaccine?
No, we don't have the DIVA vaccine.
So is that another area of research that's going on?
Yes.
Yeah, fantastic. There's another question. I mean, you have touched on those, but perhaps you could summarize for us, what are the top blockages to the success of the program? Now, you spoke about having sent out a questionnaire to a number of countries, and 80% of them have responded. But could you summarize what are the top 3 blockers to the success of the program?
The first one is funding, money. This is one of the first one. The second one is maybe the environment situation, the pastoral, the security, the pastoral, the animal movement, and animal and human movement. This is, but the second one we did it, we had the same problem with reindeers. We managed to address it. The third one is really the coordination and even the vet services, or maybe the stakeholder. Because for the time being, the stakeholder, they are not really motivated, or maybe there are a lot of emergency, maybe linking it again to maybe the first one, money. With COVID now, all county will redirect resources for COVID. It means that even the stakeholder who are motivated in terms of PPR, they will start looking, no, maybe our priority now should be COVID. Therefore, the first stop is funding, the second one is animal and human movement, and the third one is how to mobilize all the stakeholders for the eradication.
So this perhaps next question follows on a little bit from that, is that how are you able to reach out to nomadic populations?
The nomadic population, this is what I was saying, the second option, the second problem that we have, challenge that we have, is animal movement and human movement. But we have, again, lesson from reindeer pest, we have the so-called community animal health workers. And now we even have drones who are able to bring the vaccine in specific area. It means that if we are able to train community animal health workers in remote area, we are able maybe to even use drone to deliver the vaccine in that area. Therefore, the problem of the pastoral is not a major problem anymore. And by the way, even the vaccination, when we want to do the vaccination, we do the awareness ahead. But then the day of the vaccination, we go to the watering and grazing area. Because we know that during the daytime, animals, they will come for water. They will come for graze. Therefore, the problem of the pastoral area is not really, but it could be maybe a problem because we vaccinate in this area, we don't vaccinate in that area. Therefore, after 2 days, they mix, and then you have to start again from the scratch. This is why I was in one of the meetings, I think it was in Australia, they asked me, how are you, if today you had the resources, what will be your strategy to make sure that, I tell them, look, if there is resources today, we'll first of all make sure that we produce enough vaccine with the quantity of the small ruminant that we have around the world. Then we'll do the awareness communication. And then we decide 1 month during the year time, we have a vaccination for all animals in 1 month. If we are able to achieve it, in 2-3 years, we will get rid of PPR.
One of the other questions that are coming through is asking about is there any issue with regional unrest? I know that where there have been efforts to vaccinate children, for example, against polio, there have been attacks against those people who have been trying, to deliver these things. Is this similar with people who are involved in the PPR eradication program?
I don't know whether Brownie Jones, she is connected. She will have been the one, because together she was in Southern Sudan when I was in Somalia for reindeer pest. And we were training community animal health workers. And community animal health workers, even me as veterinarian, I was physician in Southern Somalia. Because you have also to treat, when you come and then children, they are sick, you have also to care about them. Therefore, the lesson from smallpox and other polio, we use it for reindeer pest, for PPR, for reindeer pest, and then we are using it now for PPR, because we have to make sure that we address, and this is where the One Health is even coming very stronger. We have to have more knowledge as we are going in pastoral area as physicians, so that you are also able to, even you yourself, if you get diarrhea in the field, when you are in the field, because the quality of water when you are going in the field is really worse. It's not water that you have in Europe. You will not have mineral water every time. Even if you are sick, how are you able to treat yourself? Because you will be there alone. You will not have a physician anymore. Therefore, I will even look myself when I am going in the field. Therefore, the One Health is there. The lesson from polio, yes, we use it. Community animal health also came because in Southern Sudan, when they come, come and today we're going to treat children. So no, you cannot treat my child without looking my animal. You have to look both of them. This is where the community animal health is coming from.
So it's very much, it is really important to have that local engagement and understanding and education in those areas to overcome any, you know, misconceptions that might be politically founded. One of the other things, going to finance, who is funding it at the moment? You mentioned that you have a shortfall of 996 million. So who has been funding it so far, and where are the potential future sources of funding coming from? I'm thinking of Bill Gates. You know, he contributed at all?
For the at all, I will not say. I will not say no, because in 2014 they commissioned a study to understand the socioeconomy. The number that the $2.1 billion, the study was commissioned by Bill and Melinda Gates Foundation.
Ah, I see. Yes.
But for several reasons, they have not been involved in the investing on PPI eradication. They were conditioned that we have to make sure that we address few of their conditions. However, the major donor now at the World Bank country, they are taking loan. We also have IFAD. We have Islamic Development Bank, African Development Bank. We also have American, EC, Russia, China, but in several countries in Asia, being China, Mongolia, India, or many countries in Middle East, they are supporting the program themselves using their own resources.
I mean, it's just a complete no-brainer, isn't it? That, you know, investment in this program would have such significant savings. I suppose countries can only offer money up in tranches, and, you know, one hopes that your shortfall will be addressed by as time goes by. Another question come through is that you mentioned one of the objectives of the strategy is to reduce the impact of other major infectious diseases of small ruminants. And which are those? Which diseases are those?
Currently, we have been, at least I will have mentioned it during in the vaccine slide. There are a lot of research combining PPR vaccine with sheep and goat pox, for example. Or, you know, sometimes countries, they are reluctant for the vaccination. You have to have incentive. Why we cannot even deworm few animals when we are there in the field? If we have any antibiotic or any antiparasitic, why we cannot deworm animals? But during the roadmap meeting, we asked each country to tell us, or each region to tell us what are 1, 2, 3 diseases that they should combine with PPI eradication. We have the table of the disease that they can combine with PPI. I can share the table with who want to have it. In any case, many of them, they are blue tongue, sheep and goat pox, brucellosis, Rift Valley fever, and so on.
Another question's come through to ask why you think the disease has not spread to Malawi and other countries in Southern Africa yet.
I knew that Neil would have come with this question.
And what are the risks of this happening?
Why the disease has not, the antibody were detected in Zambia and in Malawi. Antibody. But we have never had the disease in this country. We don't know whether they are animal vaccinated in DRC Congo or Tanzania who move to these countries. And when we were doing the surveillance, they pick antibody. But we also have to take into account the sensitivity and the specificity of the ELISA kit that we are using. Why the disease have not reached SADC countries? Because of even the strategy that we have. We have been doing a lot of vaccine in Tanzania and DRC Congo to make sure that we have as the buffer zone. We have been doing the surveillance in all that region. In addition to that, if you remember one of my map at the beginning when I was showing the correlation between the small ruminant density, poverty, and prevalence of the PPR, the small ruminant density is very low inside the country compared to intertropical African countries. This could be also the reason why there is no the disease, there were no incursion of the disease inside the countries.
I've got a couple of questions that just relate to, do you know what the current situation is in Afghanistan and Pakistan in terms of their progress?
Yes, it is. This is why I took the example, when you mentioned about few countries, I took the example of Mongolia and Somalia. Why I took Somalia? Because Somalia is maybe in the worst situation compared to Afghanistan and Pakistan. Pakistan, at least they have one government. They have the ministry. Afghanistan as well. But we managed with 2 NGOs to undertake the vaccination in Pakistan and Afghanistan using community animal health workers. Because one of the issues that we have to take into account is that although they are being shooting, I was working in Somalia, but this guy, livestock is their livelihood. When you start thinking that we will do the vaccination, they start fighting. They stop fighting. They will let vaccinator doing their job. Then when you go, and then they continue. Therefore, vaccination or surveillance sometimes is the area, if one of the methodology that we can use if we were supposed to be involved in peacekeeping. We can use the vaccination at least to have the time to maybe to bring something in the country.
There's one other question here about needing veterinary involvement at strategic top level in international organizations. So the question is it more important to have diplomats or to have people who will ask the hard questions and speak the truth to power?
We need everybody. We need diplomats because at the end of the day, they are the ones who are deciding. Why we cannot, as veterinarians, maybe have objective by 2025 to make sure that at least one member of the parliament in each country is veterinarian. If we are able to have it, we are sure that he will be able to take into account the interests of the vet community, and he will be able to move, and we will get more resources. If we have more resources, it means that we are able to control the element, all the food that we are bringing on the table. We'll be able to control diseases. We'll be able to control zoonotic diseases, therefore controlling also, it will be problem for public health. Therefore, we need everybody, but diplomats will play their role. We need economists because they have to turn number on policy, on advocacy. We need traders, because traders, they have to convince everybody that if I don't sell my animal, I will have problem. We need women association, because they have to come and advocate that small ruminant is our livelihood. If we are able to have small ruminant healthy, we are able to have milk for our child, we are able to sell animal or meat or skin and so on, and send our son at school. We are able, for Muslim community, we are able to have a lot of animal for our festivity and so on and so forth. Therefore, everybody, we need everybody to make sure that we are able to advocate and target and get the 2030.
I've got one final question, because I'm conscious that we've overrun our time, but I just don't want it to stop because it's so fascinating. and it's a practical question. When you're going out and vaccinating animals, is there any consideration of perhaps tattooing or marking the animals in some way to show that they have been vaccinated? You know, putting a tattoo in their ear or something?
Yes, we have to.
So you do that currently?
Yes, we have to, because as I was saying, as we don't have the diva now, if not, animal, they will be vaccinated. You will not be able to know whether it's the disease is still circulating or it is because the animal has been vaccinated. Therefore, when you do the vaccination and you hear not the animal, when you come, if you test that animal and that animal is negative, it means that your vaccination, the quality of your vaccine. You have to go back and look the quality of your vaccine. But if the animal is positive, now at least you know that animal is positive, if being that that animal is immunized at least for 3 years, you are safe at least as far as PPI is concerned. Because for the time being, we have never discovered one animal who have been vaccinated with the good vaccine and it turned to be infected later. Never.
Well, I think that I'm going to have to close the meeting now because we're 10 minutes over. But Felix, the number of accolades that are coming through from the people who've been listening are really lovely, and I hope you get to see
How many
those.
are connected?
I'm not sure. I
53.
can't see. Yeah, but I mean, the talk is, a lot of people have been asking whether or not your slides will be available afterwards, because I think there's an awful lot of information in your presentation that people want to take away and really digest. So I know that the webinar will be available to watch again at your leisure, but people are saying, you know, thank you, Felix. It's an inspiration to listen to you talking, and how wonderful this work is, and that we you know, really grateful that there are people like you who are doing such a fantastic job. And as I said, you know, the Sheep Veterinary Society will go back and consider what role we can play in.
You are welcome. We need you. I already discussed we need volunteer, we need those who can give any kind of contribution, because alone we cannot. It is our mandate, all of us.
Yes. Well, thank you very much, and I'll call the meeting to closure, and just remind people that there are 2 other presentations this afternoon, one at 3 o'clock and another at 5. One is from Cindy Wolf talking about sheep farming in America, and the other one is at 3 o'clock. And I can't get the details up at the moment, so maybe Philippa can come in and remind me.
Yes, if you can hear me, that's
Thank you.
Prof Melaku, and that's at 3 o'clock. That's and 2 vet students who I know are watching.
That's right. Yes.
And they will be. They're talking from Malawi, with some excellent presentations once again to follow on from what was a fantastic one from Felix.
Yeah, I'm really excited about the Malawi presentation as well, to understand what those vet students are doing. So it's turning out to be a really great day, and thank you to everybody who's joined in, and thank you to Philippa and Fiona and Flock Health Limited for making this a seamless process. Thank you.